This is Dr. Thomas Klein. I'm a rare and chronic disease specialist with 42 years experience. My entire career has been centered around people with long-term disease, and the people that I see and care for and discuss and research are people who have been identified by the government as having to take medicines every day for their pain, and it's passed off as low back pain. No. According to our polls, 93% of people who follow us on Twitter, that's 30,000 people, taking a little sample, it appears that 90 to 95% of people who are in chronic pain actually have one of the rare painful diseases. And if you want to read more about rare painful diseases, you can go to our website at JAF. I can find a little card here. The JAF website is, it's JATH educational.com. And on there you can find all the articles we've published, and there's one about rare painful diseases called Catalog. You can also find it on the web by Googling Medium Catalog Klein, and that'll give you a discussion about who the people in the United States really are with pain. They are people with incurable disease, mostly all rare: interstitial cystitis, pudendal neuritis, CRPS, adhesive arachnoiditis. These are diseases that are unfamiliar to most doctors. So we plan on at JATH writing a little volume on rare diseases, so that when people come in and say, I got pain all over my whole body, you need to listen, because these are symptoms of rare diseases. Now, the problem is that we treat people with rare diseases with opiate pain medicine, the only stuff that works for these horrible diseases. The FDA says you can use as much as you need, watching for side effects, just like you can use as much insulin as you need, watching for side effects. But a group of people really, you'll recall, petitioned the FDA, and their thinking was that these drugs really don't work, and they have too many side effects, and therefore they should be stopped. There is a person at this organization that said people should be forcefully tapered off their medications. Well, that's already occurring, and we have at least 40 suicides cataloged on our website, and you can find that by Googling Medium suicides. This is why people are killing themselves. The United States government, through the CDC, with consultants from PROP, ignored the FDA report, which you can read. I think we gave it to you last time, that basically said this is not true. But they went ahead anyway through the CDC. The CDC's director at the time made a public statement that pain medicine is no different than heroin pills. Do you think he was biased? He also made a statement that doctors are responsible for the opioid epidemic. He made a flat statement without backing it up. I don't know where the American Medical Association was at the time, but I do know that it's recommended he now appear as an expert witness in trials against doctors who supposedly were responsible for this. And maybe he should explain to the courts and explain to Congress what he meant by that. And was that just a flat statement without data? We have looked and looked and looked. And basically, prescription drugs do end up on the streets. 80%, though, are not prescribed. They end up because they're stolen. So if anybody wants to make a statement that the sky is falling in, and run chicken little run. There should be some science behind it before a federal agency starts a policy of destruction. There are 5 to 7 million people in the United States whose lives have been destroyed, who are sitting on couches. And like my patient who's thinking about killing themselves again. Why bother with life when you are in such agony all the time? Relieved beautifully with medication, in his case high dose because he's a big huge man, and his disease and several other factors. Remember, FDA says it doesn't matter about the dose, but this is what everybody talks about. All the states talk about 90 milligrams. We got to get below 90 milligrams. It's kind of like a football score. Some states think if you go lower than that, you're going to be even better. But what did the FDA say? No threshold, petition denied, inaccurate data. There is no such thing as a 90 or 100 milligram cutoff in the eyes of the FDA, who's in charge of all prescription drugs. They are the agency with the congressional authority. So this 90 milligram, the next thing that happened is CDC publishes a conversion table. Now we need a conversion table, or morphine milligram equivalents, MME, that you'll hear a lot about. And that's because people don't realize that drugs milligram has to do with its atomic weight. So you can have an antibiotic with 1 milligram, and you can have an antibiotic with 500 milligrams, and they can be the same because their chemical structure is different. The same thing is true for opiates. Now, they created a table that you can look up, and all over the table it says you can die from taking too much, so that you can switch back and forth between the various medicines with the different milligrams. This is actually a fairly dangerous thing because they didn't really research where all this data came from. Apparently a lot of it came from animals. In the GP Notebook, which is the Bible in the United Kingdom for medical, it's a nice, you can just get it online, you can download it. Anyway, their official stance in the United Kingdom is, it is not possible to accurately predict equivalent doses in most cases. This is especially true for street drugs, blah, blah. It's problematic to convert from one drug to the other when the half-lives are not equivalent. This can be dangerous. According to Jeffrey Fudin, who writes a lot about these issues as a pharmacist, and he said, recent evidence suggests the use of dose conversion ratios, MME, may lead to fatal dose. How about that? In other words, you get these conversions wrong trying to treat by the numbers. We doctors don't like to treat by the numbers. We have a doctor-patient relationship and we like to treat the patients. Not with this 90 milligram. It's swept the country. Pharmacies, hospitals, insurance companies have all glommed onto this. Another study that's out of the Cleveland Clinic, current information on these tables is confusing and dangerous to the public. CDC made a mistake in it and tried to bury it, so it's full of mistakes as well. The FDA, when they reviewed the original petition, this MME table was brought up and they didn't like it, and they asked PROP to give them some more information, and apparently it wasn't forthcoming because PROP was busy going over to the CDC with their information. It looks like about half of the experts and writers and staff that were hired by CDC come from this group. This is a narco-phobic group. We've been looking into papers published by all of them, and they are starting to add up to a very biased and unusual group of doctors that have an extreme viewpoint. Now, it's okay to have extreme viewpoints, but you don't go to federal agencies and set the world on end and end up with people killing themselves because they're being refused pain medicine that we've used for 4,000 years. The one last thing I'd like to bring up is what is 90 milligrams? 90 milligrams is 2 oxycodone tablets a day. It's also the dose for a 10-year-old. We did a survey and 2/3 of people needed more than 90 milligrams. 1/3 were okay with 90 milligrams. So 90 milligrams is the dose for a child. It's also a dose that only takes care of 1/3 of patients with chronic disease. So maybe it's time that Congress calls the FDA for hearings and says, where did you get this number? Because we've got 5 million constituents whose lives have been ruined. Thank you.